All right, let's jump right into a field of medicine that is, incredibly rare, but absolutely critical. We're talking about vascular trauma in children, injuries to the blood vessels of the youngest patients out there. And it's a challenge that honestly pushes surgical skill to its absolute limit.
Now, what's so wild about this is the paradox at its core. Look at this number. Vascular injuries, they happen in less than 1% of all pediatric trauma cases. It's not something you see every day. But, and this is a huge but, when it does happen, the stakes just could not be higher.
And this quote right here, this really puts it all into perspective. Even though these specific vessel injuries are rare, they fall under the massive umbrella of pediatric trauma, which is the #1 killer of kids over the age of 1. So for the doctors on the front lines, getting this right isn't just important, it's the difference between life, death, and a child's future.
So in this explainer, we're going to break it all down. First, we'll get a handle on just how serious this threat is. Then, we'll look at what causes these injuries, the puzzle of diagnosing them, the incredible skill it takes to repair them, and finally, what the future looks like for treatment.
Okay, so that rarity we just talked about, it actually creates a huge problem. Because there are so few cases, it's really hard to create a one-size-fits-all playbook for treatment. It also means that any one surgeon, whether they're in trauma, vascular, or orthopedics, might go years without seeing a case like this. It's tough to get that deep, hands-on experience.
And where the injury happens, wow, that changes everything. If we're talking about the body's core, the trunk, so the neck, chest, or abdomen, the mortality rate just skyrockets. We're talking about a coin flip chance of survival, often because these injuries come with massive damage to other vital organs. It's just devastating. So let's shift gears and talk about how these injuries happen in the first place. And the answer is kind of fascinating because it completely changes depending on the child's age. There are really two main pathways to this kind of trauma. So on one side, you have what are called iatrogenic injuries. That's just the medical term for an injury that happens because of a medical procedure. Think placing an IV or a catheter for a heart procedure. And on the other side, you have non-iatrogenic injuries. That's all the stuff we usually think of as trauma: car crashes, bad falls, or penetrating wounds.
And this chart just shows that shift so clearly. For tiny newborns, almost all of these injuries are iatrogenic. They happen right there in the hospital. By the time kids are 2 to 6, it's about a 50-50 split. But look at what happens after age 6. The whole script flips. Over 2/3 of these injuries are now from that external, non-iatrogenic trauma.
Now we get to one of the biggest headaches for doctors, actually finding the injury. I mean, if there's a penetrating wound, it's pretty obvious, right? But most of these cases in kids are from blunt trauma. And the clues, well, they can be almost invisible.
And that's the million-dollar question. What do you do when a kid has a badly injured arm or leg, but there are no hard signs? No big bleed, no giant bruise that's getting bigger by the second. How can you possibly know if a major blood vessel deep inside has been torn or is completely blocked off?
Well, it's a very careful, systematic process. First things first, you stabilize the child from any immediate threats. Then, once they're stable, you reevaluate everything. They'll use a handheld Doppler to literally listen for blood flow. They calculate something called the Injured Extremity Index, which is basically just comparing the blood pressure in the injured limb to a healthy one. If they're still suspicious, a CT angiogram or CTA gives them that definitive roadmap of the damage.
Okay, so let's step into the operating room, because repairing an adult's artery is one thing, but operating on a child's blood vessels, that is a whole different ballgame, with a unique set of challenges that demand unbelievable precision and foresight.
It really boils down to 3 core challenges. First, just the size of the vessels. I mean, we're talking about arteries that can be just a couple of millimeters wide, incredibly tiny. Second is spasticity. A child's blood vessels are super reactive. They can spasm and clamp down just from being touched, which chokes off all the blood flow. And third, and this is probably the biggest one of all, future growth.
This is just so critical. Any repair has to last a lifetime, but more than that, it has to grow with the child. A standard running stitch, which is common in adults, could act like a purse string, right? It would cinch down and prevent the artery from getting bigger as the child grows up. So, to avoid that, surgeons often use these individual, interrupted stitches. It gives the vessel all the flexibility it needs to expand over the years. It's brilliant, really.
But even with all this knowledge, it's not always clear what to do. Take this classic dilemma. A child breaks their elbow, and it disrupts blood flow to the hand. The hand is still picking warm, which is good, but you can't feel the pulse. So, what's the call? Some doctors say wait, watch, maybe use some blood thinners, and hope the pulse comes back.
Others argue you have to go in surgically, right away, to make sure there's no hidden damage. It is a major debate, and honestly, there are great arguments on both sides.
So, given all of these intense challenges, where does the field go from here? Well, the good news is the medical community is actively trying to figure out how to improve care and create a more standard approach for these incredibly complex cases.
And the consensus is really pointing in a clear direction. The goals are to build shared protocols so every kid gets the same high level of care, no matter where they are, to create national databases so we can learn from every single one of these rare cases, to design brand new tools actually built for tiny bodies, and, big picture, to shift the whole philosophy away from just watching and waiting towards more aggressive, early surgery to prevent those long-term problems.
And that leaves us with the central question, doesn't it? This isn't just about surgical technique anymore. It's about the entire system. For an injury that any single doctor might only see a handful of times in their entire career, the ultimate challenge is building a system that guarantees expertise and the absolute best outcome for every single child, every single time.